The clavicle is the collarbone. It is part of the pectoral girdle and assists in swinging the upper limb away from the trunk. This is a major adaptation for the primates who climb trees in vacuation. The clavicle is placed directly below the skin of the shoulder region. It is divided into a lateral 1/3 and a medial 2/3. The lateral 1/3 is flat, while the medial 2/3 is cylindrical. It has two ends by which it articulates with different bones. A sternal end with a sternal facet by which it articulates with the sternum, and a clavicular end by which it articulates with the clavicle. The clavicle has two borders at its lateral flattened part. They are the anterior border and the posterior border. It also has two surfaces at its flattened part, a superior surface and an inferior surface, which carries the subclavian groove. The clavicle has the following border. At its lateral 1/3, it has an anterior border which carries the deltoid tubercle for the attachment of the deltoid muscle, and a posterior border. It also has two surfaces. A superior surface and an inferior surface. The inferior surface carries the trapezoid line for the attachment of the trapezoid ligament and a conoid tubercle for the attachment of the conoid ligament. It also has a subclavian groove by which it is attached to the subclavius muscle. The scapula is called shoulder blade. It is placed behind the rib cage laterally and covers the 2nd to the 7th ribs. It is held in position by muscles which move the glenoid cavity and therefore the shoulder, that is the glenohumeral joint. It is triangular in shape. The scapula has three processes: the acromion, the coracoid process, and the spine. The radius has three surfaces: anterior surface, lateral surface, and posterior surface. The radius has the following parts: a head which is cylindrical and rounded, a neck which connects the head to the shaft, a tuberosity which is called the radial tuberosity, and the shaft of the radius. There is a lower portion which carries the radial styloid process. At the posterior end of the lower part, there are grooves which transmit extensor tendons. The humerus is the longest bone in the upper limb. It has three parts: the head, the shaft, and an inferior portion called the condylar part. The head is connected to the shaft via two necks: an anatomical neck and a surgical neck. The anatomical neck connects the articular head with two tuberosities, while the surgical neck is the weakest portion that joins the shaft with the head. It is most liable to fracture. The head has an articular portion which articulates with the glenoid cavity of the scapula. It is rounded. The head also has two tubercles: a greater tubercle or tuberosity and a lesser tubercle or tuberosity. In between the two we have the intertubercular sulcus. The articular head is separated from the rest of the head by the anatomical neck. The shaft is the longest part of the bone, and it carries the deltoid tuberosity for the attachment of a deltoid muscle. The inferior part of the humerus is called the condylar part. This part has two divisions. It has an articular portion made up of capitulum laterally, which is convex, and the trochlea medially, and non-articular parts, which are the epicondyles of the humerus. We have the medial epicondyle and the lateral epicondyle of the humerus. The articular part also has a radial and coronal fossa. These two are placed anteriorly. The olecranon fossa is placed posteriorly. The humerus has three borders. The anterior border runs in front of the greater tuberosity to the condylar area. The medial border runs on the medial lip of the intertubercular sulcus. The lateral border runs through the groove for the radial nerve. The humerus has three surfaces: an anterolateral surface, which is between the anterior and the lateral borders; anteromedial surface, which is between the anterior and the medial borders. The posterior surface is between the medial and the lateral borders. The radius is the lateral bone of the forearm. It has three borders: anterior border, interosseous border, and posterior border. The radius has three surfaces: anterior surface, lateral surface, and posterior surface. The radius has the following parts: a head which is cylindrical and rounded, a neck which connects the head to the shaft, a tuberosity which is called the radial tuberosity, and the shaft of the radius. there is a lower portion which carries the radial styloid process. At the posterior end of the lower part, there are grooves which transmit extensor tendons. The ulna is the medial bone of the forearm. The ulna has a proximal end which is massive. This is provided with an auricular process and a trochlear notch. It has a sharp coronoid process whose medial end is provided with the sublime tubercle that provides attachment for the flexor digitorum superficialis. Its distal part is called the ulnar tuberosity. It has a shaft and a lower end which carries the head and the styloid process. The shaft is triangular in shape. The ulna has three borders: an interosseous border, an anterior border, and a posterior border. The posterior border is subcutaneous throughout its length and therefore palpable. The ulna has three surfaces. The anterior surface is between the interosseous border and the anterior border. The medial surface is between the anterior and posterior borders. The posterior surface is between the posterior and interosseous borders. There are 8 bones which form the carpus, and they are arranged in 2 rows. We have a proximal row and a distal row. The proximal row consists of the following bones. You have the scaphoid, the lunate, the tracheatrium, and the pisiform. The distal row of bones consists of the following. You have the trapezium, the trapezoid, the capitate, and the hamate. The scaphoid is the most lateral of the bones of the proximal row. It is the largest. It has a rounded tubercle, which is called the tubercle of the scaphoid. The lunate is the next to scaphoid, from lateral to medial, and it is semilunar in shape. The tracheatrium is sandwiched between the lunate and the pisiform. The pisiform looks like a pea. It is a big sesamoid bone. It is the most medial of the proximal row of carpal bones. The trapezium is the most lateral of the distal row of carpal bones. It has a tubercle at its ventral aspect and a groove. The trapezoid is the next bone to the trapezium. The capitate is the most central of all carpal bones and the largest. It articulates with metacarpal 3. Hamate is cuneiform in shape. It is provided with a hook of hamate by which it articulates with metacarpal 5 through ligaments. Metacarpal bones are 5 in number, and they are labeled from lateral to medial. We have metacarpal 1, metacarpal 2, metacarpal 3, metacarpal 4, and metacarpal 5. They are placed distal to the carpal bones and articulate with the distal row of carpal bones. These are the trapezium, the trapezoid, the capitate, and halite. They help to form the endoskeleton of the hand as opposed to that of a digit, which is formed by the phalanges. Metacarpal bones have a distal head, a shaft, and a base. The heads articulate with the phalanges, while the bases articulate with the distal row of carpal bones. The bases also articulate with each other, excepting the first and the second metacarpals, which remain separate from each other by a small interval. This is to enable the thumb to perform opposition. Metacarpal 1 is the bone which is related to the thumb proximally. It therefore assists the thumb in carrying out its locomotor and other skeletal functions. It is short and thick. Metacarpal 2 is the bone which forms the support for the index finger. It is therefore the longest, with the longest shaft, and also the largest base of all the metacarpal bones. This is presumably to be well adapted for this index function. Metacarpal 3 has a short styloid process at its base as its distinguishing feature. This styloid process sometimes remains as a separate ossicle. It supports the middle finger. Metacarpal 4 is short and quite thin when compared to the second and the third. It has no styloid process at its base, but is provided with a distinguishing oval facet for articulating with metatarsal 3. It supports the ring finger. The phalanges of the hand represent the endoskeleton of that hand. There are 5 digits, and they are the thumb, the index finger, the middle finger, the ring finger, and the little finger. All the digits have 3 phalanges each, which are labeled proximal, middle, and distal. Proximal, middle, and distal, excepting the thumb that has only 2 proximal and distal phalanges. There are therefore altogether 14 phalanges in the hand. The phalanges of the hand, just like the metatarsals, have a head which is placed distally, and a shaft and a base, both proximal to the head. The distal phalanges are provided with ungual tuberosities. At their distal extremities, all the phalanges have two surfaces, anterior surface and posterior surface. The hip bone is also called innominate bone. It is made up of three bones joined together at the acetabulum, the ilium, the ischium, and the pubis. The pelvic girdle is formed at the articulation of the two hip bones at the symphysis pubis. The hip bone has an inner or medial surface and a lateral or outer surface. The ilium has an iliac crest, which runs from the anterior superior iliac spine to the posterior superior iliac spine. Inferior to the superior spines, we have the inferior spines, the anterior inferior iliac spine and the posterior inferior iliac spine. The posterior superior iliac spine is an important landmark in the pelvis, for it determines the end of the sacral canal at the level of S2. It is the point of venous dimple in the female especially. The iliac crest is provided with three lips: an outer lip, a middle or intermediate lip, and an inner lip of the iliac crest. These lips provide attachments for muscles of the abdominal wall. The ilium has an iliac fossa. At this junction with the pubis in front, it is provided with an eminence called the iliopubic eminence. It articulates with other bones of the hip bone at the acetabulum. The pubis has a body which is placed in front, which articulates with the body of the opposite side at the symphysis pubis. The body has two processes, and they are as follows: a superior ramus and an inferior ramus. The superior ramus carries a pubic crest, which is provided with a lateral prominence called the pubic tubercle. It has a pectineal line This pectineal line is formed at the pecten pubis. The pecten pubis of the superior ramus articulates with the ilium at the iliopubic eminence. The inferior ramus provides the pillars for the pubic arch, and together with the opposite side forms the subpubic angle of the pelvis. It joins the ischial ramus inferior, and together they form the ischiopubic ramus, which provides attachments for the adductor muscles. The femur is the longest and the strongest bone in the body. It is divided into three parts. An upper part, which has the head, the neck, and the two trochanters, greater trochanter and the lesser, which carries the medial and the lateral condyles. The head of the femur is cylindrical and it has a pit which is called the fovea capitis, by which the ligamentum teres, or the round ligament of the head of the femur, is attached to the head. This ligament carries blood from the acetabulum to the head of the femur. The head is smooth. The neck is also cylindrical and long. The femur has the longest neck of all the long bones, and is a true surgical neck, unlike the humerus that has a distinct anatomical neck, which is its growing neck, as opposed to the weakest point between the head and the shaft. This is easily liable to fracture. The neck is placed at an angle of 125 degrees to the shaft and ends at its junction with the trochanters. The greater trochanter and the lesser trochanter, they both are interconnected by an intertrochanteric crest posteriorly and an intertrochanteric line anteriorly. An intertrochanteric fossa is placed just inferior to the greater trochanter. The shaft of the femur begins at the trochanters. It is long and cylindrical. It joins the neck at the trochanters, greater and lesser trochanters. These trochanters are joined in front by intertrochanteric line. And behind by the intertrochanteric crest. The crest has a corded tubercle at its middle. The shaft carries some important landmarks at its back. They are the linea aspera, the linea aspera runs from its junction with the spiral line medially and the gluteal tuberosity laterally. It then runs to the supracondylar lines inferiorly. You have the medial and the lateral supracondylar lines. The distal extremity of the femur carries the condyles and the intercondylar area. The lateral condyle is more massive and bigger than the medial one. It carries the lateral epicondyle. The medial condyle is smaller and it has the adductor tubercle for the attachment of the adductor magnus. The patella is a big sesamoid bone placed in the course of the quadriceps femoris, running from the femur and hip bone to the tibial tuberosity. It is the largest sesamoid bone in the body. It is a flat bone with the superior aspect forming a curve and its inferior forming a triangle. The patella has three borders as follows: a superior border, a medial, and a lateral border. The patella has two surfaces, an anterior surface and posterior surface. Tibia is the most medial of the bones of the leg. It is next to the femur in length amongst the long bones. Its proximal end is bigger than the distal one. The tibia is almost triangular in cross-section at its upper two-thirds. It can be divided into a proximal part, a shaft, and a lower part. The proximal part of a tibia carries two condyles, the lateral and medial condyles. They articulate with the corresponding condyles of the femur. The condyles are separated by an intercondylar eminence. And it also has tubercles. The upper part of a tibia carries a tibial tuberosity. This is a prominent landmark which provides attachment for the ligamentum patelli. The tibial shaft is triangular in cross-section. It is provided with a soleal line at its back for the attachment of the tibials. It has a prominent subcutaneous shin, which is the anterior border. The lower end of the tibia presents with a prominent medial malleolus and a groove for the articulation with the trochlear surface of the talus. It also has a triangular fibular notch on its lateral aspect for articulating with the fibula. The tibial shaft has three surfaces as follows. The posterior surface is placed between the interosseous border and the medial border. The medial surface is placed between the anterior border and the medial border. The anterior or lateral surface is placed between the anterior border and the interosseous border. The fibula is the lateral bone of a leg. It is much thinner than the tibia. The fibula has three main parts. The head, which is provided with an apex that is the distinguishing feature. This apex distinguishes the head from the distal lateral malleolus. This has a rounded lower extremity with a triangular subcutaneous surface above it. The fibula also has a long shaft which is provided with a crista medialis. The head of a fibula is slightly expanded and carries an apex called the styloid process. It distinguishes it from the lateral malleolus, which has no styloid process. The shaft of a fibula is long and presents with a crista medialis. The distal end of a fibula is expanded slightly inferiorly from the shaft, and it presents the lateral malleolus of the ankle. The medial malleolus, on the other hand, is formed by the tibia. The tarsal bones are placed in the proximal aspect of the foot. They articulate with the metatarsal bones distally and tibia and fibula proximally. They are 7 in number as follows. The proximal row contains the calcaneus, the talus, and the navicular bone. The distal row consists of the cuboid, lateral cuneiform, intermediate cuneiform, and the medial cuneiform. The talus is the bone of articulation at the junction between the leg and the foot. It has a trochlear surface which articulates with a groove in the inferior aspect of the tibia. It has a head, a neck, a body, and lateral tubercle. The body carries the trochlear notch and the lateral tubercle. The calcaneus lies below the talus. It is the largest tarsal bone. It has the following: a calcaneal tuberosity, a sustentaculum tali, a sulcus calcanei, and 3 articular facets for talus and 1 for the cuboid. The navicular bone is sandwiched between the cuneiform bones distally and the talus proximally. The medial cuneiform bone is wedge-shaped like other cuneiforms. It articulates in front with the first metatarsal and behind with the navicular bone. Intermediate cuneiform is wedged between the lateral cuneiform and the medial cuneiform. It also articulates distally with the metatarsal too, and proximally with the navicular bone. The lateral cuneiform is sandwiched between the cuboid and the intermediate cuneiform on the medial aspect. The cuboid is the most lateral of a distal row of tarsal bones. It articulates distally with the metatarsal 4 and 5 and proximally with the calcaneus. The metatarsal bones form the scaffolding of the foot. They are the endoskeleton of the foot. They are 5 in number and are labeled in reverse order when compared with the metacarpals of the hand. The most medial is for the big toe and is labeled metatarsal 1. This is because of the rotation of the foot during embryological development, so that the big toe, which was initially most lateral like the thumb, became the most medial. The effect of this is to turn the plantar surface of the foot to its present position, dependent anatomically at its back, while the dorsum of the foot is placed in front. The second toe supports the metatarsal 2. The third toe supports metatarsal 3. The fourth toe supports metatarsal 4. And the fifth supports metatarsal 5. Metatarsal 1 is the thickest and the shortest of all the metatarsal bones. Its distinguishing feature is the groove for the peroneus longus placed at its medial aspect. It also has 2 facets for articulating with 2 sesamoid bones at its plantar surface of its head, the medial and the lateral sesamoid bones. Metatarsal 2 is the metatarsal of the second toe. Its distinguishing feature are the following: 4 articular facets at the base, 1 for the intermediate cuneiform, and another for the medial cuneiform, and yet another or 2 demifacets for the lateral cuneiform. Metatarsal 3, which is carried by the third toe, has a base that is triangular in shape. Metatarsal 4, which is carried by the fourth toe, has a unique articular facet at its base for articulating with the cuboid. Metatarsal 5 is carried by the little toe, and it has a distinguishing tuberosity at its base. This is the tuberosity of the fifth metatarsal. It is also called the styloid process of the fifth metatarsal, and it provides attachment for the peronei brevis et tertius, and also for the abductor digiti minimi. Phalanges of the foot are small bones. They are 14 in number, and they form the endoskeleton of the foot, that is, the toes. There are 2 for the big toes, the proximal and distal phalanges, and 3 for other toes, named as proximal, middle, and distal phalanges. The phalanges of the foot resemble those of the hand, but are shorter, and their shafts are compressed on their sides. They also have a base, a shaft, and a head. The head is placed distal to the shaft, and it carries a tuberosity on its plantar surface. The sternum is the breastbone. It is found only in land animals. It is also called mesosternum. The junction of the sternum with the manubrium is called the manubrosternal junction, and it forms the sternal angle of Louis. It is divided into 4 segments. The sternum proper is divided into 4 segments, which are called sternibri. The first sternibri, the second, the third, and the fourth. It has a tail, which is called the xiphoid process or the xiphisternum. The sternum has 2 lateral borders. The borders carry the facets for articulation with the 2nd up to the 7th costal cartilages. The manubrium has 2 lateral borders. And a superior border which carries the clavicular notch. There is a jugular notch between the heads of the clavicles. The inferior border of the manubrium articulates with the sternal upper border to form the manubrosternal junction. The sternum has 3 surfaces: anterior surface, posterior surface, and superior surface, by which it articulates with the manubrium at the manubrosternal junction. There are 12 pairs of ribs in the body. The first rib and the 11th and the 12th are atypical. The first 7 ribs, 1, 2, 3, 4, 5, 6, 7, are said to be true ribs, while the remaining 5 are false. The last 2 are floating. Typical ribs all have shafts which project posteriorly and anteriorly. The shafts carry angles, posterior and anterior angles. Typical ribs have the following parts: a head, a neck, and tubercle. The tubercle has articular and non-articular parts of tubercle. Other features include a costal groove. Ribs have their anterior extremities replaced with costal cartilages. This reach the sternum and articulate with it. The costal cartilages are found in all ribs, and they reach the sternum except the 11th and the 12th. The first 7 costal cartilages reach the ribs, the sternum, directly. Number 1, number 2, number 3, number 4, number 5, number 6, number 7. While the 8th, 9th, and 10th articulate with the lower aspect of the cartilage above. A typical rib has a head, a neck, articular part of tubercle, non-articular part of tubercle, a posterior angle. The head is provided with 2 facets and an intermediate crest separates the two. The first rib is the shortest, and it is flattened superior inferiorly and very curved. It has no non-articular part of tubercle. It has a long neck and a prominent scalene tubercle at the superior surface. It also has a groove for the subclavian vein. The 10th rib has only one facet on its head. The 11th rib has no tubercle, no neck, and only one facet on its head, and its cartilage is found at the end of a rib without articulation. It also has a shallow costal groove with a slight costal angle. The 12th rib has no neck, no tubercle, and only one articular facet on its head. Its cartilage is found at the anterior end without articulation. It does not have a costal groove and has no angle. A typical rib has two borders, the superior and inferior borders. It also has two surfaces, an inner internal surface and an outer external surface. The articulated pelvis forms a pelvic canal, which is the birth canal. It is different in males when compared to females because of the obvious function in parturition in the female. Hence, it is wider and broader in the female than the male. Above this canal, at the level of the pelvic brim, we have the greater or the false pelvis. The pelvic canal itself is the true or the lesser pelvis. The bones of the pelvis are as follows: the hip bone, the sacrum, and the coccyx. The hip bone is further divided into the following: a superior ilium, a posterior ischium, and an anterior pubis. Sacral vertebrae have the following distinguishing features. The 5 segments are fused to form a single bone. 1, 2, 3, 4, and 5. Only the first has a superior articular process. Dorsal and ventral sacral foramina. This is ventral sacral foramina and dorsal sacral foramina. Represent the intervertebral foramina of the upper vertebral segment for transmission of sacral nerves. Lateral sacral crests are fused transverse processes. Intermediate sacral crests are fused articular processes. Median sacral crests are fused spines. Other features of the sacrum include The sacral body is wide and its projecting edge forms the sacral promontory. This is an important landmark in obstetrics. It has a short pedicle. The transverse process fused to form the lateral mass of sacrum on each side, which are called the alar sacrum. The alar sacrum. Coccygeal vertebrae have the following features. They are fused to form a thin triangular bone. The segments taper into a small nodus at the tip of the coccyx. It does not have any recognizable feature found in other vertebrae because of advanced fusion and degeneration during embryological development. There are three cavities of the birth canal. The inlet is also called the pelvic rim. The mid cavity is placed at the level of the ischial spines. The outlet is placed at the level of the lowest dimensions of the pelvic canal. For clinical pelvimetry, four important measurements are recognized. The first is the diagonal conjugate diameter, which measures the dimension from the lower part of the symphysis pubis to the sacral promontory. The finger is insinuated into the pelvic canal and it attempts to reach the sacral promontory. The second is the subpubic angle. This angle is acute in the male pelvis, but obtuse in the female. The third is the intertuberosischial diameter. This is diameter between the two ischial tuberosities. It must be able to fit the knuckle of the hand. The fourth is the interspinous diameter. This is the diameter between the spine, the ischial spine, and the other ischial spine. This dimension is measured, however, clinically by the sacrospinous diameter, which is the diameter from the ischial spine and the lateral aspect of the sacrum. It is about 4 centimeters in length in the normal subject. The skull is a skeleton of the head, including the face. It is made up of 14 different bones, some paired and some single, to include the mandible. The cranium, on the other hand, is skull without its mandible, although this definition is not strictly adhered to. The upper part of a skull is called the calvaria, while the remainder is the facial skeleton. It is the exoskeleton of the brain. It protects the brain in a rigid cage. The skull can be described from the following views. Anoma verticalis. Anoma frontalis, Anoma parietalis, and Anoma basalis. The skull has a total of 14 individual bones, and the following are paired bones of the skull: temporal, parietal, zygomatic, mandible, maxilla, palatine bone, inferior nasal concha, lacrimal, nasal, and sutural bone. Others include the frontal bone, the ethmoid, the occipital, the hyoid, the sphenoid, and the vomer. The frontal bone was originally two, but was later joined by the metopic suture so that it exists in the adult as a single bone. It forms the forehead. It has an external part and an internal part, which forms the roof of the orbit. Its frontal surface forms two frontal tuberosities, which are called bursae. The supratrochlear and supraorbital margins are placed at the junction between its external and the orbital parts. Parietal bones are paired. They cover the parietal cortex on the sides of the cranium. They possess two surfaces: external surface and internal surface. Temporal bones are paired and found at the sides of the cranium below the parietal. The temporal bone has the following distinct parts: a squamous temporal part, a petromastoid part, which is divided into a petrous temporal, and a mastoid part. The occipital bone forms the base and back of the cranium. It encloses the foramen magnum. It has the following parts: a squamous part, a basilar part, and lateral or condylar parts. The sphenoid bone is single and internal although a small portion, which is the greater wing and the pterygoid process, appears at the sides and base of the skull. It has the following parts: a body of a sphenoid, a greater wing of a sphenoid, and lesser wing of a sphenoid. The pterygoid process. This is further divided into two parts: a lateral pterygoid plate and medial pterygoid plate. The medial pterygoid plate carries the pterygoid hamulus. The sphenoid concha is right inside the bone. The ethmoid bone is single and placed internal, although it projects part of its lateral surface externally. It has three main parts: a cribriform plate of the ethmoid, the perpendicular plate of the ethmoid. This is found at the upper part of the nasal septum, and the ethmoid labyrinth, which are on the lateral aspects of the nasal cavity. These carry anterior, posterior, and middle ethmoidal ear cells. They also are provided with two processes called the superior and middle nasal concha. A crista galli projects from its perpendicular plate together with two alar processes. The zygomatic bone, which is paired, forms the prominence of the cheek. It takes part in the formation of the following parts of the skull: the orbit, the infratemporal fossa, and the zygomatic arch. The maxilla is the bone of the upper jaw. It has left and right sides, which are fused at the middle. It is next in size to the mandible in the whole skull. It forms the major part of the roof of the buccal cavity, assisted by the palatine bone posteriorly. The mandible is the bone of the lower jaw. It is single, having been fused in embryological development, leading to the formation of a false symphysis called the symphysis menti between the two halves of the mandible. The mandible is the largest and the strongest of the bones of the skull. It has a curved body with two processes. The body carries a mental tubercle on the side of the symphysis menti and has an internal oblique mylohyoid line. The mandible has two processes: a columnar process, which has the head of the mandible, and a coronoid process, which provides attachment for the temporalis. The vomer is a single bone providing the bony aspect of the nasal septum posteriorly. It is flat and thin bone and forms a shape similar to that of trapezium. It articulates inferiorly with the maxilla and palatine bones. and superiorly with the septal cartilage on the anterior aspect, with ethmoid at the middle and with the sphenoid posteriorly. The palatine bones are paired, and they are divided into two parts: a horizontal plate and a perpendicular plate. Nasal bones are paired. They are variable in size. They join each other at the bridge of the nose across the midline. They articulate with the frontal process of the maxilla. Lacrimal bones are paired. Small bones are the medial margins of the orbit. They are smallest of the bones of the skull. The inferior nasal concha are paired and found at the lateral margin of the nasal walls, complementing the middle and superior nasal conchae, which are the processes of ethmoidal masses. They articulate with the maxilla, lacrimal bone, and ethmoid. Vertebrae are those bones which are placed at the midline of the back. They protect the spinal cord by forming a ring of exoskeleton around it, thereby creating a spinal canal for the transmission of the spinal cord and its nerves. There are about 32 to 34 vertebral bones in the body as follows: cervical, 1 to 7, 1, 2, 3, 4, 5, 6, 7. Thoracic, 1 to 12, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Sacral, lumbar, 1 to 5, 1, 2, 3, 4, 5. Sacral, 1 to 5. And coccygeal, 1 to 3 to 5. All vertebrae have anteriorly placed large body by which they articulate with each other, separated by an intervertebral disc. They also have transverse processes which move from the body laterally. They also have a spine by which they move posteriorly, and a canal between the body and the spine. They articulate with each other by two facets: a superior articular process forming a facet, and an inferior articular process forming an inferior facet. The pedicles and the laminae join the body to the transverse processes on both sides, and they form the lateral walls of the vertebral canal. Vertebrae have the following distinguishing features: all process foramina transversaria, which transmits the vertebral artery except cervical 7. Typical cervical vertebrae have bifid spines. Typical cervical vertebrae have triangular vertebral canal. Typical cervical vertebrae have superior articular process facing backwards and upwards. A typical cervical vertebrae have uncus, which forms the lip of a vertebral body. Thoracic vertebrae have the following distinguishing features. The single spine. They articulate with the ribs at two facets, a superior costal facet and inferior costal facet. All their transverse processes have facets for articulating with tubercles of the ribs, excepting the last two, because of the atypical nature of these two ribs. Lumbar vertebrae have the following features. They have no costal facets. They have no foramina transversaria. The mammillary processes are available on the posterior aspect of the superior articular process. The superior articular process turns inwards like a curve. The transverse processes are thin and long. Cervical 1 vertebra is called the atlas. It articulates superiorly with the condyles of the skull and inferiorly with the axis. It has the following special features in addition to the features of all cervical vertebrae, e.g. foramina transversaria. It has no body. It has no spine or no true spine. It has an anterior and posterior tubercles of the anterior and posterior arches respectively. It has lateral masses instead of pedicles and laminae. It has a long transverse process. Cervical 2 vertebra is called axis. It has the following features. A superiorly projecting prominence which is called the dens or the undoubted process. It has a body which carries this dens. It has both pedicle and laminae. It has a bifid spine. It resembles all cervical vertebrae but has a dens, which is its main distinguishing feature. Sacral vertebrae have the following distinguishing features. The 5 segments are fused to form a single bone. 1, 2, 3, 4, and 5. Only the first has a superior articular process. Dorsal and ventral sacral foramina. This is ventral sacral foramina and dorsal sacral foramina. Represent the intervertebral foramina of the upper vertebral segments for transmission of sacral nerves. Lateral sacral crests are fused transverse processes. Intermediate sacral crests are fused articular processes. Median sacral crests are fused spines. Other features of the sacrum include the sacral body is wide and its projecting edge forms the sacral promontory. This is an important landmark in obstetrics. It has a short pedicle. The transverse process fused to form the lateral mass of sacrum on each side, which are called the ala sacrum. The ala sacrum. coccygeal vertebrae have the following features. They are fused to form a thin triangular bone. The segments taper into a small nodules at the tip of the coccyx. It does not have any recognizable feature found in other vertebrae because of advanced fusion and degeneration during embryological development.